By Darius Spearman, African Elements. Support African Elements at patreon.com/African Elements and hear recent news in a continuous playlist during your morning commute. Plus get early access to ad-free video content. Unveiling the harsh reality, early hypertension in black women triples stroke risk, magnified by the shadows of racism. The intersection of hypertension and stroke risk. Recent findings illuminate a grave health concern. Black women with hypertension before age 35 are at triple the risk for strokes in later life. This startling revelation underscores the urgent need for targeted healthcare interventions. Source: American Heart Association. Black women treated for high blood pressure in their 30s and 40s may face a substantially higher risk for having a stroke than their peers without a history of high blood pressure treatment, highlights the American Heart Association. Racism's role in health disparities. Adding complexity to this health crisis, a study points to racism as a significant factor exacerbating stroke risk. Black women facing racism in daily situations, employment, housing, or with police, see their stroke risk increase by 38%. This association emphasizes the intersection of societal stressors and health. Source: Chobanian and Avedisian School of Medicine. Our findings suggest that the high burden of racism experienced by black U.S. women may contribute to racial disparities in stroke incidence, explains Dr. Shanshan Sheehy. Advocating for comprehensive care. Dr. Hugo J. Aparicio urges a holistic approach to healthcare, one that transcends medication to address broader psychosocial stressors. The goal is to tackle hypertension's root causes and mitigate stroke risk effectively. Healthcare policy changes are needed so that primary prevention is promoted and funded, because by the time a black woman has a stroke at middle age, it is often too late, Dr. Aparicio states. Source: American Heart Association. Toward health equity, strategies and solutions. Healthcare providers must emphasize early screening and holistic care, incorporating strategies to manage both hypertension and its psychosocial triggers. It's vital to recognize and address the unique challenges black women face, ensuring equitable access to prevention and treatment. Final thoughts. The recent studies on hypertension and stroke risk among black women highlight an urgent need for systemic change. By understanding and addressing the compound factors of early-onset hypertension and the impact of racism, healthcare providers can offer more effective, compassionate care, moving closer to health equity for black women. About the author. Darius Spearman is a professor of Black Studies at San Diego City College, where he has been pursuing his love of teaching since 2007. He is the author of several books, including Between the Color Lines, A History of African Americans on the California Frontier through 1890. See more Black news and history content at africanelements.org.